Let's go back to part 4 of chapter 2. So in last part, we have been talking about different types of ingredient for cosmeceutical. For example, skin lightening agent, anti-inflammatory agent, agent that improve our skin barrier functions. So let's continue with different types of the active ingredients for cosmeceuticals. So the following type that we have to talk about will be the anti-acne agent. Okay, so the first major active ingredient that used for anti-acne agent would be very typical. That is benzoyl peroxide. So benzoyl peroxide is an anti-inflammatory, antimicrobial, and keratolytic wound healing agent. Okay, so and it can be metabolized into benzoic acid within our skin. Okay, so it can be synthesized in lab. So, and of course, it is belonging to the acne therapy product. Okay, so for topical use, it can be used alone or combined with other ingredients that we have been discussed before. So, for example, retinol, okay, or antibiotics. Okay, so for overall treatment of acne. Okay, so it can penetrate into our skin and absorb unchanged into our structure corneum. Okay, so and in the epidermis or dermis, it will be metabolized to benzoic acid and absorbed as benzolate and excreted in urine. Okay. So for safety use issue, it may cause photocarcinogenity. Okay, so the US FDA recommend concentration of benzoyl peroxide used in personal care product will be 2.5 to 10%. So that is safe and effective. Okay, but overuse may cause the irritation, such as the contact dermatitis or irritant dermatitis. So be careful. So also, it will also speed up the skin aging process. So because it breaks down into benzoic acid in the skin, okay? So and free radical will be formed as intermediate, and that will cause the DNA damage. So and breaks in our keratinocyte. So and may harmful to protein or lipid. Okay. So that's why when use of the benzoyl peroxide, additional required warning and directions for over-the-counter drugs, topical acne product should be used. So when it is used alone or combination of other active ingredient. So these are the safety issues. So for formulation considerations of benzoyl peroxide, it is insoluble in water but very soluble in organic solvent. So the use of urea, glycerin, or the emollient, that is a dimethicone, so will improve the skin tolerability when using the benzoyl peroxide. So encapsulating the benzoyl peroxide, so or if uh, it is used as microspongy, okay, so may slow the delivery of benzoyl peroxide and reducing the risk of irritation. So that's why it is very suggested to use the microspongy dosage form of the benzoyl peroxide. So another anti-acne agent, okay, so that will be commonly used in conjunction with the benzoyl peroxide with salicylic acid, okay. Salicylic acid is again anti-inflammatory pore cleansing agent, okay. So it has both the natural and organic forms, okay. So however, most salicylic acid are lab-made. So it belongs to cleansing, anti-acne, pore minimizing, and exfoliating agent. Okay, so and for topical use, the penetration of salicylic acid into the skin, okay, is regulated by the barrier function of our skin. Okay, so that's why the use of some organic solvent, for example, acetone or tape stripping or detergent may cause an increased penetration of salicylic acid. So for topical use, the suggested concentration of 3 to 6% is used. So to treat, for example, some skin infection disease, for example, psoriasis. Okay, so for higher concentration, such as 5 to 40%, so that is the medical that requires medical consultation. So that will be used for the removal of wart and corns. Okay. So, salicylic acid is not phototoxic and photosensitizer. Okay, so that's why all patients treated with salicylic acid audit so should use a broad spectrum sunscreen. Okay, as a part of their daily skincare. Okay, because the salicylic acid is an exfoliant and increased exposure of our dermis or epidermis to UV radiation by reducing the structural corneal thickness. Okay, so most common risk of using salicylic acid will be just the burning of the skin if the patient's structural corneum is thin from exfoliation. Okay, to prevent the silicium. Okay, so it is not suggested to peel the large surface area at the same site. Okay. So that's why when we are using the high concentration, so it will cause redness, itchy, peeling, or even increase our skin sensitivity or to a worse situation that is the blister. Okay, so salicylic acid cannot be used for pregnant women, breastfeeding, or allergic to aspirin. Okay, so that is not suggested to use salicylic acid. So for formulation consideration, okay, so the typical concentration that we can homemade will be zero point 0.5 to 2%. Okay, so for medical strength, okay, or prescription drugs that will be high as, I mean, the concentration can be high as 20 to 35%. So penetration of salicylic acid in aqueous base is better than Vaseline base. Okay, so and the effect of pH, okay, on the penetration, so of the salicylic acid was optimum at pH 2. Okay, so then another anti-alert agent, okay, will be the retinol ester, or retinol acid. Okay, so they belong to retinoid derivatives. They are anti-inflammatory. Retinol is a form of vitamin A. Retinolic acid is the metabolite of vitamin A. Okay, so retinol palmitate, okay, so is again the derivative of the vitamin A palmitate. Okay, so retinol occurs as vitamin A in nature, so and it's commonly found in many personal care products and must be lab made. Okay, so some of them are natural and synthetic derivative of vitamin A, so included in the family known as retinoid. Okay, so we will also discuss in details later. So you know vitamin A, which is good for our eye vision, so can be found in carrot. Okay, so we also call it as the carotenoid. Okay, so that's why, okay, so the carrot or beta carotene on skin will not be sufficient, okay, because the lack of penetration of these ingredients. Okay, that's why it's better to use so the pure retinol. Okay, so retinol ester or retinolic acid. So this will be a different origin classification of retinol. So, okay, so for personal care category, so we have three major generation of retinol. So the first and the second generation, okay, bind with several retinol receptor because they are more flexible. But the third generation retinol, they are less flexible than first and the second generation. So, and they will interact with fewer retinol receptor, okay? So, for the mechanism in the treatment of acne for topical use of retinoid. So retinoid is comedolytic. It can remove comedones, okay, through desquamation that affect the cell adhesion and regulating characterization. Okay, retinoid downregulate so the TLR, okay, toll-like receptor 2, resulting in acne symptom improvement. Okay, so retinoid will also decrease the pro-inflammatory cytokine, okay, production. So cytokines, okay, so is a factor that will cause the inflammation in our epidermis, okay. So for safety issue, retinoid can cause the redness and breaking the stability of retinol, so can be affected by other ingredients and is very unstable when exposed to sunlight or UV. Okay, retinol palmitate may have the risk of generating so ROS. Okay, so that is the free radical after UVA exposure. Okay, so that will speed up the aging process. So for formulation consideration, okay, so the retinol containing product must be manufactured so in a especially low light condition to ensure the stability. So the ingredient, for example, the benzoyl peroxide, as I told you before, so will affect the stability of retinol, especially exposure to light. Okay. So some products we especially add some antioxidant to maintain the stability. Okay, so and we should have to separate uh, processing. So when benzoyl peroxide and retinol are added in combination in a product. Okay. Okay, so the next type of active ingredient that we will talk about will be the anti-aging agent. Okay, so for example, we have different type of hydroxyl acid. So hydroxyl acid is a kind of anti-inflammatory, exfoliating, anti-acne, and depigmenting agent. So we usually have three major forms of hydroxyl acid, what we call the alpha hydroxy acid, AHA, polyhydroxy acid, PHA, and beta hydroxy acid, BHA. Okay, so they are naturally occurring organic acid, so and have the effect of exfoliation and accelerate the cell cycle. Okay, so here shows some example of the AHA, so and BHA. Okay, so for example, salicylic acid is a kind of BHA. So these hydroxy acid found in the natural sources, so but some of them synthesized in lab for the use of chemical pills. Okay, so for topical use, okay, so AHA and BHA product can be used for the treatment of photoaging. Okay, so however, hydroxy acid is rather actinic, and seborrheic keratosis can also effectively treated with the HA and the BHA. So the topical preparation with hydroxy acid so has very strong effect on epidermal characterization, so and speed up the cell cycle and decrease the corneocyte cohesiveness. So and that will cause increased desquamation. Okay, so that means the dead cell are pulled upward. Okay, towards the epidermis. Okay, so that's why the use of HA and BHA in high concentration can cause the detachment of keratinocytes, okay, and epidermolysis, okay, so and cause the erosion and blister, okay. So for AHA, there are two major effects you must know. So the first one is it has moisturizing effect, okay, especially good for dry skin. So it acts as the humectant, okay, so and help to hold water on our epidermis. So the second major function of AHAs will be it enhances desquamation and normalizing stratocorneum. Okay, so by removing the cleaning keratinocyte that may cause our skin rough. Okay, so that's why the result is that our skin is more flexible, so and it's more lustrous. Okay, because it can reflect light. So application with lower concentration will decrease the intercorneal site cohesion directly above the granular layer. So that's right, desquamation and thinning of stratocorneum. So, but not the epidermis. So remember, two major effects, okay, for use of AHA. So the first one is it enhance, okay, so the cell cycle and increase the desquamation as I have told you. So and also cause the improved skin tone and light reflection as well as smoother skin surfaces. Okay. So some safety issues concerning the use of AHA. So although HA increased desquamation, okay, so it may leave the epidermis more vulnerable to UV radiation. So and thinning of the stratocorneum. So and that will increases the photosensitivity after use. Okay. So US FDA has issued a guidance for labeling of HA containing cosmetic products. So the counter drugs products are limited to have the maximum percentage or concentration of AHA to be 10% only. That is the maximum. So for BHA, one very significant BHA would be the salicylic acid. So salicylic acid, 20 to 30% should not be applied to the whole body in one session. Okay, so because it may cause the ototoxic. Okay, so and different body segments should be treated at different times. Salicylic acid, as I've told you, it can be used as anti-acne agent. Okay, so because it has the exfoliating properties. So the overdose, okay, salicylic acid overdose may cause the salicylate intoxication. So that's why be careful about that. Okay, so for PHA, polyhydroxyl acid, so PHA do not cause sunburn cell formation and it provides some protection from UV radiation compared with HA and BHA. Okay, so but for the FDA labeling guidelines, so they should be labeled as sunburn or not. Okay, so be careful with the misleading and labeling with false labeling. Okay, so for the formulation considerations, so hydroxyl acid formulation, they are acidic in nature. So and therefore the pH, okay, so of the formulation type, combination of ingredient is quite pH sensitive. Okay, so pH will affect the amount of acid form. Okay. So the next type of the agent, well, again, we'll talk about the retinoid. Retinoid has appeared, okay, in the last type of agent that is anti-acne. So again, retinoid can be used as agent again, okay. So we have a natural retinoid and synthetic retinoid, okay. So synthetic retinoid is rather stable. Okay, so for example, tauratotine and adapalene. Okay, so they are the third generation retinoid. Okay, so because the natural retinoid is very difficult to be formulated because they're very unstable, photosensitive, so they will be degrade. Okay, so under light. Okay. So retinoid can be natural, can be synthetic. Okay, it's derivative of vitamin A, as I told you before. So it belongs to anti-aging and anti-acne product. Okay, retinoid has the effect at the molecular level by regulating the gene transcription and affect the activity, for example, the cellular differentiation and proliferation. Okay, retinoid can treat and prevent photoaging by inhibiting the breakdown and loss of collagen, and that's why it stimulates the skin cell, that is the fibroblast, so to increase, okay, so or to trigger the collagen synthesis. Okay, so with the use of the retinoid, it can help to remove the cellular atypia, so compacting our structure cornea, decrease the clumping of melanin and basal cell, so and it will correct the polarity of keratinocyte. Okay, so that's why the dead cell are easily pushed upward. Okay, so to the upper layer of the epidermis, so that will increase the desquamation process. Okay. Okay, so the ultrastructural changes, okay, for the retinoid caused um by the retinoid, of course, that include, okay, the hyperproliferation of keratinocyte and melanosome size reduction. Okay, so and one retinoid that we used will be the um, tretinoin. Okay, so can decrease the wrinkles, and that's why we used it for photoaging treatment. Okay, retinol can penetrate skin better and improve the appearance of the wrinkle in a sun protected area. So concerning the safety issues of the retinol, so overuse of the retinol may cause the erythema, skin irritation, desquamation, flushing, and facial stinging. Okay, so the most common side effect of overuse of the retinol. So these effects can be reduced by applying retinol on top of the moisturizer. So because it can limit, okay, the penetration and decrease the amount and frequency of application until the retinol can be tolerated. Okay, so when use of retinol is very be careful for the pregnant women, okay, or okay, so to prevent so the potential risk of systemic absorption that will affect the fetus. Okay, in terms of the formulation consideration, okay, so tretinoin and retinol is very unstable, okay, because it will dissolve in oil phase and it is very easy. They are prone to degradation when exposed to UV light, air, okay, heat, water, and lipid peroxidation. Okay, so that's why some antioxidant will be added into the formulation so to enhance the stability of the retinol when they used it, okay, as the active ingredient in the product. Okay, so that's why when they are formulated, usually we use the airless system with no exposure to light. Okay, so and the packaging of the product will be used it with the aluminum tube. Okay, so with a small mouth or airless pump. So they must be manufactured, formulated, and packaged properly to mainly avoid the oxidation. Okay, after oxidation, so retinol will lose the potency, and that is no use. So that's why we add some UV absorbing agent or antioxidant, as I've told you, can increase the stability of this product. So nowadays, we will use the nanoparticles will also have the increased efficacy, stability, and tolerability of the retinoid agent. Okay, so that's all about the chapter 2. Okay, so we talk about different mechanism of actions, and I have to introduce some active ingredients for most commonly found cosmeceutical. So thank you very much for chapter 2.